Okay, and welcome. I've got a great session for you today. I'm Eric Chong, and I'm the CEO of UpgradeMyPractice.com. We've owned and now work with dental practices that earn at least $3 million a year to help them grow and set up their practices for exit within 3 to 5 years, so they don't ever have to worry about working inside their practice and or making money from their practice ever again. The reason for this training is for any dentist or dental practices making less than $3 million per year is to help you get there, so it makes things easier if and when we choose to work together. All right, so I'm really excited about this training because I'm going to be introducing the health starts from mouth concept because that really makes or breaks the difference between the dentists and the dental practices that are doing medical billing the right way and that are doing it the wrong way or the risky way. Because medical billing is a must for dental, and if you don't already realize that from the other videos that we've watched, you should by the end of this presentation, because we're going to be sharing some more information on exactly why it is a must for dental. And more importantly, we'll be sharing what to do and what not to do. What are the things that could potentially get you in trouble and shut this whole thing down, right? So we'll share with you what to do, how you can get the cash flow rolling in consistently and confidently into your practice in a way that you can sleep at night, right? So that's what this is all about. We're going to be covering the what of the medical billing for dental, what it is not. If you're not already on this page, I encourage you to visit upgrademypractice.com/learn, and you'll be able to find this video, which is the what or what is not medical billing for dental, and many of the other videos. If you haven't seen the start or the why video, and then later we'll be sharing other videos as far as the when and the how to. Again, you're going to want to make sure you go to upgrademypractice.com to see the other videos and the downloads we have for that. Okay, so what I see, and the biggest problem in dentistry right now that you may not even realize, is that most dental practices, and I would say that 80 or 90% of dental practices, are all fighting for the same piece. And that's what makes it difficult. So if you've read the book Blue Ocean Strategy, you'll know what I mean, but it's very easy to explain. There's a red ocean or a blue ocean, and you definitely want to be in that blue ocean, but most people don't realize that they're in the red ocean. And what that means is if you haven't read the book, the red ocean is the shark infested waters. It's the oceans without any fish left because there's too many sharks and there's too much blood in the water. That's what current dentistry is focused on. And without the whole sharks and fishes aside, what I mean is the whole dental insurance part of the society, or the group that's covered under dental insurance, mostly the employed people. That's where most dental practices are focused on. Whether you're taking dental insurance or whether you're taking cash only. It's funny, some of these dentists, they brag about taking cash only, but I look at their treatments and their menus and they're still focused on the same patient group. So they may have a little bit of a better time, but it doesn't always last. And the reason why is because they're still in the same group. Now, in the pediatric care, this is a very good area, especially if you've been around and you've established a reputation. Pediatric is a great area, but it has its nuances and it is very complicated and can be very difficult, especially when you get the more complicated cases. So I know there's some dentists that just don't even like doing pediatric at all. Plus it's already small work inside the mouth, but pediatric makes it even smaller. And just some hands aren't equipped for that. However, when it comes to just dentistry or the demand for dental, the biggest missing piece of this boat is a piece that's been there. It's been inside our practices, meaning we have these patients already. And these are patients that we are equipped to deal with. Like, we already have all the training and the clinical skills. We just haven't focused on this group. And what I'm going to share with you is this 65 and older category, but it's not just by age 65 and older. The blue can actually come down a little bit because it's not an age specific thing. It's just anybody with a medical need or a health need. All right, so what we're going to cover in this section or in this training is going to be the dentists are doctors of the mouth. We already know that, especially if you've been following our other videos, but we're just going to touch on a very quick thing and what it means for medical billing, why medical billing is a must for dental, for dentists and your dental practice. I'm going to go over specifically what medical billing is and what it is not. And then we'll be going over the 3 steps to get ready. So there's 3 things that must happen before you start or before you send your claims for Medicare or medical billing. And then we'll be discussing the Medicare billing process itself. And then also the system, a Health Starts from the Mouth system that will help keep you safe and help keep your practice in line in doing medical billing the right way. So that's what this presentation will be about. We'll first talk about the doctor portion, because if you're not already getting paid for the most important part of the work that you're doing, or the first line of your job, literally by definition, that's the biggest problem, and that's what we're going to solve first. So in this presentation, it's the how to get paid for treating the diseases and conditions that affect the mouth and the teeth, right? So that's what this is all about. We're going to show you exactly how you could get paid fully to unlock your doctor's pay, how to recoup the missing revenue, not just in your practice, but in the work that you've been doing, and to claim some hidden reimbursements, not just in the medical. There's a lot of practices and dental codes that we see missing in almost 80%, if not 90% of practices that we talk to. So we want to show you that as well. I mean, I can't cover everything in this training, but we're going to share with you exactly where to look and to do it safely, to do it in a way that protects your practice. Because at the end of the day, health does start from the mouth and dental is medical. And as we understand these things, there is a difference in a profitable practice and one that drags its feet and still runs it the way the dental insurance companies wanted you to run it. All right, so why medical billing is a must for dental? We're gonna just look at this as 2 circles, right? And what I first thought when I came across this subject was the overlap was very small, meaning the dental work that we do in our practice, when the dental work affects their health, improves their health, is life-saving or life-improving in any way, I mean, it's health-related, right? So just because something is dental, it doesn't mean like the health or medical component goes out the door. In fact, it's quite the opposite. The health and medical component are always there and is always most important. But we need to decide, are we doing this for more of a dental need? Like, is this just like a fixing or alignment of a tooth that doesn't really have anything to do with their bite, occlusion, or any of their medical, needs to have a healthy jaw? Like, is it just like whitening? Is it just 2 shades brighter? So anyway, the way I determine this isn't by complicated products or services. It's just, is this dental treatment also health related? And as these 2 overlap, this section of overlap is clearly just medical, right? It's let's just go back to the basics. We don't want to overcomplicate this, folks. All right, so what we found is that overlap between the health and the dental, what we thought was just a few cases. As we look at this more and more, and we don't forget or deny the health or the medical because all of a sudden dental is, part of the conversation, when we really look into it, when we ask for the medical records, when we ask for the medical history and the patient, we hear the patient out and find out other things that are going on, we find out that the overlap or the medical component to the dental treatment or the dental work that we're doing is there more than not. And we're finding out, especially in the 65 and older category, it's 90% of the time clear and cut. And I really am confident that we're going to find that that's the case in all of the other age groups as well. But I digress. So from birth, as we mature, yes, we might have some people with some needs when they're first born, and that's why pediatric can be good for the people that have developed their practice. But as we mature, and especially as we start to work, most people, they get stable, they get mature, and they get not just healthy, but they get more stable as they mature, right, as they age. And this is the population that most of the dental practices are focused on, is the healthy population, or the population, even if they do have some medical need, it's not going to be dentally driven, right? But as we age and as sickness develops, as we, eat 3 times a day and we use our mouth more than anything else, we find that that is the primary source, or that is where most infections start in the body. And go figure, we use it the most. So it's not anything that nothing I'm saying here is takes a rocket scientist or any scientist or doctor to figure out, right? We know this. As we age, sickness develops, and left untreated, it's bound to get worse. And that's what we're talking about here, is why medical billing is a must, because we're dealing with a population that is aging. And as our population is aging, almost everything is medical, but not getting paid for it and not getting recognized for our work, that is the biggest problem. So I hope that kind of solidifies that point, and we don't have to keep on touching over that. But if you have any questions, of course, just reach out to me, because this is something that's very important. The medical billing is a must for dental, and I'm not talking about Medicare dental. I'm talking about Medicare medical, because it's the only plan that allows dentists to do the work and be a doctor the way that they should, right? It makes no sense that if we have a patient literally dying, or in pain and in a life-threatening situation, I mean, we deal with it every day. Sometimes it's easy to take it for granted or not realize how serious the situation is, but all it takes is that one news story, or that one article where we have to look up where there was like that truck driver that died, or that teenager that died. And there's so many stories of people that die because they just didn't get an extraction or some simple dental work done, right? So dental is very deadly if it's not left treated. So when it comes to medical billing with Medicare, the thing that I love about it, and the reason why it's a must, is not just because of the patient demand, is because for doctors, it allows them to be a doctor and to call the shots with the patients, right? To choose together with the patient, depending on their need, what they need for the patient. It's not for an insurance company's benefit. It's not for some politician's benefit. It's not for some facility or some multi-million-dollar hospital's benefit. If the patient needs the care and the doctor diagnoses and agrees on that, then the patient can and should be able to move forward with treatment. And Medicare, as far as I've seen, is the only program that really allows the patient and the doctor to do so. And that's why I love it so much. It's the gold standard. They have no yearly maximums. There's no frequency limits. Redos are paid every time. There's no pre-authorizations. There's no missing tooth clause. And there's no contracted low fee schedule. So it's really beautiful what Medicare has done, and this is why I consider them literally the leading payer, and they are the largest payer, but also the gold standard, is because they really set the right example of how insurance should be delivered. And the reason why I say this is because it makes no sense that a doctor is stopped by a nurse practitioner or some insurance company because it benefits the insurance. What's a couple more dollars when we have people dying? And it's not just 1 or 2. I mean, we're talking about almost 2 million deaths a year, right? So it's a big number. And I fight for the patient, not a couple of dollars. You can always make more money, and you can always print more of it, right? I'm sure half of us know, I mean, it's real, we use it, but it's manufactured. We just print it out of a mint. Anyway, this is not a talking about money conversation, but we're for the patients here, right? And so when it comes to medical billing, let's not overcomplicate it. We're going to go through what it is and what it is not. Very simply, folks, the definition of medical billing, and not just with Medicare, but the definition of medical billing is the process of sending claims to receive payment for qualifying treatment to medical and or health payers. So for any dental offices out there, there shouldn't be any reason or any excuse not to do medical billing. I understand that some dentists might think that there is more risk, but I think you will learn and see how not doing medical billing puts you at more risk than doing medical billing the right way. So you just want to do medical billing not just for the money, but so you can receive treatment for the most important part of the work that you do. All right, so what isn't medical billing? There's a couple of companies and trainers out there that try to pass off cross-coding, even though it's not really medical billing, and that's when you apply dental and ADA codes to medical payers. And sometimes they will pay in unique cases from medical payers, or even like auto or workers' comp cases, because they have to, right? They have to restore them full. And really, this should be the case in all of healthcare, but that's a different subject, and we will get there. But the problem is when issues arise, right, with using cost coding, that's the problem, that you really don't really have any defense against and nothing to protect yourself. So it's not something you want to run your practice off of, and it's not anything that you can really scale or do at volume. There's just going to be too many hoops to jump through and too many things to stop you from doing so. Okay, so sleep apnea. This is something that I can speak on, and my business partner could probably speak a little bit more on, but Kim was doing up to about 30 or 40 cases a month, and I think at one point even a week. She had like 20 to 30 cases sent to her, and she had every single sleep doctor in the Bay Area referring her cases for sleep apnea. The reason why she decided to stop was after becoming a medical biller, realizing that the code that dentists were using for sleep apnea on the appliances was something that the lab should be using. So unless if you have a lab set up and you're the one fabricating the appliance, it's probably not something that you want to be doing. But sleep apnea can be done, and you can bill for all of the, not just the treatment, but the post-care and the sleep studies. So those are things that can be done, and a lot of practices do. But I just want to mention that most people are billing for codes that can put them in a gray area or can put their practice more at risk than it's worth. Okay, so we'll get into the 3 steps to get ready for medical billing for dental, and it's very simple as a dentist. You don't want to overcomplicate it. The first part is just to get credentialed. And then it's 855I form. You can literally Google it, fill it out, and this is how the doctor will get credentialed. And then you want to get a biller. That's going to be the fastest way. I mean, you can go through the classes. If you do it fast, you can probably get it done in about, I think, 6 months or 12 months, but it'll probably take most people up to 2 years. And you'll see you don't really have 2 years, because you only have about 12 months to go back to send claims. So it's not just for treatment moving forward. You can even go back up to 12 months. And this is why it's better just to find a medical biller that is specialized in dental, because you can't just get any medical biller either. They just won't know how to code it properly, and you don't want them to practice or learn from your mistakes. It's just going to be a lot of headaches and back and forth. And then the third part is once you got fully set up and you have your billing set up, like you have your electronic payments, you've got your credentialing, and everything is set up, like Medicare recognizes that you are a medical provider and you're a physician now, you're ready to get your doctor's pay. So that's it. You get credentialed, you get your billing set up, and then you just want to call and confirm. And once you've done that, you get your doctor's pay. You can send in all of the medical billing claims that you want, and now you know you will get paid. That's the biggest difference, by the way, between dentists that get paid for their claims in medical billing and the ones that don't, is having a credentialing. And it's essentially just registering with the government and letting them know that, yes, in fact, I am a doctor, right? The MPI just registers you as a dentist. This P10 registers you as a physician of the mouth. And that's what they need to see, right? It changes the registration a bit, or enough for it to matter. All right, and then as far as the medical billing process, it's very simple, right? We just want to, and by the way, you don't need to write down all this stuff on this page. If you scroll down, if you're not already on this page, upgrademypractice.com/learn, you will be able to get this resource by downloading the cheat sheet. If you click on the button, the cheat sheet, you will be able to download this form, and you'll be able to take it with you or refer to it anytime you need. So the medical billing process is very simple. Anytime you have a new patient or even your existing patients, you just want to ask if they have Medicare or any medical cards for that matter. But the reason why we start with Medicare, and you'll see, is because it's like training wheels. It's easy, it's consistent, and it pays. So, and there's the highest demand. I mean, even if you take all the medical billing claims, like still 8 or 9 out of 10 claims that you'll be sending are Medicare. So that's why we want to get really good with Medicare, and we want to get trained on this first. It is really where the focus should be because of the demand, right? That's just where we see it. All right, so you want to ask for the Medicare card, submit all the qualifying work, and get paid. Again, let's not overcomplicate it. It is very simple. Of course, there's a lot of nuances to the billing and coding, but that's why if you have a biller and coder that does all that work for you, all you do is just do the work that you do as a dentist or in a dental practice, and none of the other things really change, right? Except for just asking for the card, but you do that anyway. It's just a different card that you're checking. But really, nothing really changes in the practice. There are some things that you will need to learn when you do the Health Starts From Mouth system, because this isn't just about the money. And when I explain what medical billing is and what it is not, we'll go more in depth in the other video that is the how to do medical billing. So be sure to stay tuned for that, and we'll go more in depth into these topics and exactly how to do medical billing. But the reason why the Health Starts From Mouth system is important is because you really do want to learn it, right? And what I mean is learn how to do it in your practice. Sending the claim is the simple thing and how you get paid. But if you don't know how to get, more patients or how to get new patients, for example, it doesn't really matter, because you might make more money, but you might make more money for the patients that you're here, but you may not know how to get more patients. And then same with problems, like whether it's problems with patients or problems with your practice, you want to know how to avoid those things, and we share that with you. This is not just based on our experience running practices, but on helping a couple hundred other dental practices all across the nation make the transition from going from dental PPO or cash-based practices to making this transition to accepting medical. And you don't have to do the medical and put your license on it if you don't have to. Like, you don't have to get credentialed, but I just strongly recommend it. But if you don't, you can still refer those patients to one of our health planners or medical billers to get it, to get that check for you. So there are a lot of ways to do it, including how to have the consent forms for your practice. It's a very important thing, not just for the dental side, but for any of the surgery that you're doing and any of the materials, for example. The documentation samples that other dentists have used, it's good to kind of review these so that way you can see what's worked for other dentists that have done this for a long time. And we teach you how to do the health planning. I love this concept. Maybe you've heard of it, but too many dentists that I see are doing treatment planning and sales, and they're wondering why they're not getting a good result. Some of them are by doing it, and more kudos to you, but I can promise you that if you do health planning, you'll get a much better result. And what health planning is it's just another presentation or sales strategy. But the difference is instead of doing treatment planning for the practice and for the doctor, it's positioned in a way where the patient really feels like they're getting educated and they're getting like a best friend or someone that they're hiring to help them plan their health, and they're being provided the options that you can help them with. It sounds like it's similar to what most people are doing already, and it should, because it's not like it's completely different. But health planning is a new way to do treatment planning and to do case presentation in a way that really increases case acceptance. I mean, we're seeing like as high as 70 to 80% case acceptance when you do health planning versus treatment planning. So things like that are very important. How to be a doctor. We share what's worked for us in marketing. I used to run a marketing agency, so I'm happy to share all the samples, fundamentals, and best practices. There's a lot of ad samples that we've had that's worked for us as well. Most of our practices, though, ads are great, but you'll see like a lot of paid ads, and it's good to have ready for when we need it in the future, for when it gets more competitive. But you don't even really need the ads for most of our practices, we say, because if you have an existing patient base, just even going through your existing treatment that you've done over the last 12 months and the patients that you already have coming in is usually more than enough. And we'll do the team training for you, so we're not going to just expect you to learn all of this and then be able to train your team. We have specific videos, including like these videos, which we encourage all dentists and teams to watch. But there's other specific videos in which we train your team for you, so that way you don't have to spend your time doing it or try to play the telephone game and find out you got one very important detail wrong. And this is the best way, the number one best way, outside of clinical, but arguably even more than lots of clinical skills, because of the sheer, not just number increase, not just the overhead decrease, but because this is, I really believe, the thing that every dentist must do to be recognized as a doctor. So it's not just the money pit, it's the recognition bit, and really doing, or how would you say, realizing what it is that your license says that you do. So I hope that makes sense. I hope this information has been valuable for you. And we will go on into the next section. We'll be covering the when you should be doing medical billing, and why when. So get your doctor's pay. If you're not already on this page, you can visit upgrademypractice.com/learn. And you can also make sure you get a copy of your cheat sheet